Good afternoon, everyone. My name is Chastity Malone, and I am the Mental Health Administrator for Thrive Well Community Mental Health Center. Thank you for taking the time to meet today. I'm honored to step into this role and to partner with each of you as we strengthen the foundation of our organization and expand the impact of our services within the community. Today, I will be presenting our draft business plan, developed collaboratively with leadership, focusing on our vision, mission, organizational goals, and key financial and ethical priorities that will guide our work moving forward. ThriveWell Community Mental Health Center is a community-based outpatient mental health program committed to providing accessible, trauma-informed care to individuals and families across the lifespan. Our services are designed to support individuals who are navigating complex mental health challenges, including those impacted by trauma, systemic barriers, and limited access to care. At the core of our work is the belief that healing happens in connection. We prioritize patient-centered care, active client participation in treatment, and the identification of familial and social supports as essential components of long-term wellness. Our vision is to create a community where mental health and wellness are accessible to all, and every individual is empowered to heal, grow, and thrive within supportive relationships. Our mission is to provide compassionate, trauma-informed mental health services that prioritize the patient's voice, strengthen family and social supports, and promote sustainable wellness through ethical and evidence-based practices. To bring our vision and mission to life, we have established 3 primary organizational goals. First, we will enhance patient engagement by ensuring that clients are actively involved in treatment planning and decision-making processes. Second, we will strengthen family and community integration by helping clients identify and utilize supportive relationships that promote long-term stability. Third, we will improve operational sustainability through strong financial management, ensuring that we can continue to provide high-quality services to those that need them most. Each of these goals reflects a balance between clinical excellence and organizational accountability. I want to take a moment to discuss an area that is critical to our success, yet often uncomfortable to address: our financial health. Collections, accounts receivable, and cash flow balances are not just administrative concerns. They directly impact our ability to sustain services, support staff, and serve our community. When collections are inconsistent or accounts receivable remain high, it creates strain on the organization. This can limit our resources, delay services, and ultimately affect patient care. As leaders, we must approach financial stewardship with both competence and integrity. Ethical financial practices require transparency, consistency, and accountability. We must ensure that services are documented accurately, billed appropriately, and collected in a timely manner, while still maintaining compassion for the individuals we serve. I also want to address an ethical concern that has come to my attention. There have been instances where staff have not consistently applied our sliding scale fee structure. Specifically, cases where clients whose income exceeds $80,000 per year have been billed at a lower rate based on personal financial appeals. While empathy is an important part of our work, we must uphold fairness and organizational integrity. When we deviate from established policies without proper authorization, we create inconsistency, potential financial loss, and ethical risk. Additionally, inaccurate billing practices, especially when not properly documented, can lead to compliance concerns and undermine trust in our systems. As leaders, we must reinforce that documentation must reflect accurate financial information and billing must align with established guidelines. If a client expresses financial hardship, there are appropriate channels for review and potential adjustment. But these decisions must be documented and approved, not made informally. Moving forward, we will take a structured and supportive approach to addressing this issue. First, we will provide additional training on billing practices, documentation standards, and ethical decision making. Second, we will implement routine audits to ensure compliance and identify areas for improvement. Third, we will create clear pathways for staff to escalate concerns when financial hardship situations arise, so that decisions are made collaboratively and appropriately. Our goal is not to punish, but to strengthen our systems and support staff in ethical, informed decisions. At the same time, we must be clear. Accountability is essential. Ethical practice is not optional. It is foundational to our work. In closing, ThriveWell Community Mental Health Center is built on a commitment to both compassion and accountability. Our vision, mission, and goals guide us toward meaningful impact, while our financial and ethical practices ensure that we can sustain that impact over time. As a leadership team, we have the responsibility to model integrity, support our staff, and make decisions that honor both our clients and our organization. I look forward to working alongside each of you as we continue to build a program that truly supports mental health and wellness for all. Let us remain grounded in our shared commitment to empower healing, strengthen connections, and support every journey for those we serve. Thank you.